Good morning, good afternoon, or good evening, depending upon where you are joining. We appreciate you taking your valuable time to catch our session. We know there's a lot of options out there with Climate Week. As the old saying goes, if you have your health, then everything else follows. And the same applies to communities. When we have healthy women involved and leading within all sectors of our companies and communities, we all win. Hello, I'm Faith Legendre, your moderator for today. Welcome to Creating Health Equity in Developing Countries using a circular approach put on by HERhealthEQ. And now for our esteemed panelists. We truly have an incredible lineup today. We have Danielle Reyes, Counsel with Goodwin Procter LLC. She's in the firm's financial industry group, providing broad regulatory compliance advice with a focus on financial inclusion, Community Reinvestment Act matters, corporate social responsibility programs, non-financial reporting, and investor due diligence. She also serves as co-chair of the firm's environmental, social, governance, and impact practice, advising on fair and responsible banking, financial inclusion, Community Reinvestment Act issues. She also provides strategic advice regarding corporate philanthropy programs and ESG matters, conducting due diligence of target companies and private equity transactions, venture capital investments, and mergers and acquisitions, and also regulatory compliance advice in the traditional banking, alternative lending, payments, and insurance verticals, and assisting clients with product development, which we'll talk about as well with Robert, policy drafting, preparation of customer agreements and notices, and privacy issues. And also negotiating bank partnerships, agreements, representing banks, credit unions, and non-banks in fintech, and advising on licensing requirements and submissions of license registration applications. And last but not least, in her busy day, Danielle responds to inquiries from federal and state banking regulators. And now on to our second panelist today, Robert Miros is the CEO of Third Stone Design, Inc., a privately held product design and development company engaged in engineering, manufacturing, and product strategy. Product development run the gamut from medical devices to alternative energy systems to consumer products. Business activities include design, distribution, and marketing of its own products, but also joint ventures with research institutions and government entities, and consulting services to many multinationals, NGOs, and inventors. Through the company's subsidiary, Hadley Health Technologies LLC, a novel global health device, the Pulmoney BZPAP is manufactured, sold, and distributed in 36 countries. Third Stone Design is founding partner of the Nest 360 program, which is graciously funded by the MacArthur, Gates, and Elma Foundations to reduce neonatal deaths in sub-Saharan Africa by 50% over the next 10 years. Mr. Miros is a prolific inventor with over 40 granted patents in his name. He earned degrees in engineering, product design, and international relations from Stanford University. He has taught design, engineering, and entrepreneurship as a lecturer and guest faculty at Stanford and Brown universities. And last but surely not least, our host for today from HERhealthEQ. As a child, she wanted to be an astronaut. Well, it may not be a given in our world that a little girl with a love of science and a desire of space exploration would be met with support. She was wealthy in the truest sense of the word because she had choices. Her family encouraged her as she studied science and math, went to space camp programs, and attended university for engineering. Her world was one where she had choices and the freedom to follow her dreams. And in order to explore humanity in a different way, she made the choice to move into the medical device world. And we're so glad she did. Through her experience working with companies promoting women's health and developing technology to detect breast, cervical, and uterine cancers, she realized this was a path for her to help people improve their health by giving them access to equipment they needed. Living abroad in developing countries added a new layer to her understanding of choice and health equity. She was exposed to people who had fewer material possessions, but were often much happier with their lives. She came to realize that wealth couldn't be reduced to money alone, but encompasses all aspects of life, where the concept of wealth can look very different from culture to culture. She also came face to face with the extreme inequity. Living and working in Costa Rica, she saw people forced to weigh possibly life-saving care for themselves or even an ailing loved one against feeding other members of their family. It was at that point she knew she was meant to use her choices to make a difference. From the seed planted in Costa Rica grew the global nonprofit organization. She founded HERhealthEQ to raise awareness and work for equitable access to healthcare for worldwide for women. HERhealthEQ's mission is to drive health equity by providing medical devices and equipment to developing countries for women's health issues. They focus on providing equipment involved in the treatment of the top non-communicable diseases, sometimes referred to as NCDs, that affect the developing world, which include cancers affecting women, maternal health, diabetes, and heart disease. Folks, it's about equipment, equity, health outcomes for her. I'm just delighted and feel better about the world with the three of you in it. We're doing all of this work, and I wonder when you sleep. But welcome to all of our esteemed panelists today. Let's start out from the broad finance perspective, and then we'll work our way down to how the equipment is used globally. And then we'll wrap it up with you, Robert, talking about the design and the development of the equipment and where and how that equipment is used. So Danielle, again, let's start with you from this broader financial perspective, because we couldn't do all these things without the gracious donors and investors. So I hear my friends and family and many people and organizations saying, I want to invest, but I just don't want to invest in things that aren't good for the environment or are socially or racially unjust, or don't have any governance around it. I have a trust factor. So can you kindly comment, Danielle, on this trend that seems to be here to stay around this environmental, social, and governance investing, please?
Yes, I'd be happy to. And thank you so much for that gold star intro. You really have a talent for intros.
Thank you.
So I'm very happy to be here with all of you today. And I love, Faith, the way that you talked about how, you're maybe sitting around having dinner with your friends and family, and somehow impact investing comes up. Maybe they don't use that term, but that's really what they're talking about. And it's a great illustration of the shift we've seen in the mainstream market from investors wanting to maximize profits at any cost to the more mainstream approach being wanting to know what the cost is, right? So generally investors are not as willing to make money despite what other harmful impacts there may be on the environment, on the communities, on just their own, the values that they may have personally that they're just not thinking about in the investment context. So that's what people are doing now. And a lot of people are equating ESG with that whole concept, and I've come to accept that. I have a long background in corporate social responsibility, which is not really the same as ESG, but everybody's using the two terms interchangeably, and I'm just going to go with that. So I think generally people know when we talk about ESG, we're talking about risk management and business opportunities that fall into one of three categories: environmental, social, and corporate governance. But there are many ESG issues that fall into more than one of those categories. When we talk about board diversity, for example, which has been a hot topic, especially at the state level, we're talking about a social issue because we're talking about diversity, and we're talking about a governance issue because we're talking about the board of directors, which falls within the corporate governance space. There are also issues that may provide benefits in one ESG area, but cause harm in other ESG areas. So we talk about COVID, for example, employers' corporate social responsibility to protect employee health has become a really important social issue. But some measures that were taken, especially at the beginning when we were just all trying to survive, we didn't know if we were going to be around the next week, right? So it's understandable that maybe we were hyper-focused on just protecting health. But as a result, there were many environmental harms that were that arose as a result of that approach, including lots of trash and non-recyclable trash. There are other examples too, such as the hyper-focus right now on electric vehicles to solve greenhouse gas emissions issues under the E category, but that can cause harm within the S category if lithium used in the supply chains for electric vehicle batteries are sourced from areas prone to human rights violations. So something to just keep in mind, and it's important not to have blinders on when you pick your ESG category to focus on, because you may be unintentionally causing harm that you don't mean to cause. Another example is the interplay between climate initiatives and racial justice. So I'm sure you've all heard the term the just transition to a lower carbon world, which is a complex issue, one component of which is addressing the problems caused by the fact that racial minorities have historically been and continue to be subject to greater negative impacts of pollution and climate change. I just want to highlight part of the recently enacted Inflation Reduction Act, which is focused on climate change initiatives within the US. As an example, there are many areas that address racial inequities within the Inflation Reduction Act, which you might not think makes sense based on the name of the act, but there's a lot in there. Some examples include an environmental and climate justice block grant program, a neighborhood access and equity grant program, and air pollution remediation programs in disadvantaged communities and schools. And those are just a few examples. So if you are having trouble falling asleep tonight and want to just pull out the Inflation Reduction Act and skim through, there's lots of racial justice initiatives buried in there.
That was so helpful. That's what I love about these panels that Marissa curates, because she just finds people like you, Danielle, that are really giving solutions. And as Climate Week, you know, the motto here is, you know, just doing it, right? Just doing something. Yeah. And that's what you're telling us, to go to the act, find out, maybe there's some grants available for the work that we're doing or want to do in our communities. And that's an action we can take. So thank you for sharing that rich and informative information. It wasn't just about, oh, we're in a sad state of affairs. It was like, here's what we could do about it. And that's what I love about Marissa curating these wonderful panelists here today. Thanks, Danielle. I have another question for you, though. I hope you're ready for it here. Is there a possibility of different ESG sub areas to overlap with and contradict with each other? So that's something I remember you talked about.
Yes, so the example we were talking about was the electric vehicle, which I think is not an area that people really thought about as potentially a bad thing for ESG. And one specific example I want to point out for our US-based companies that have supply chains, which is most of them, right? We have a lot of tech clients at Goodwin who have historically thought that ESG was not an issue for them, because when you think about, say, human rights violations, you're usually talking about, say, retail. So, you know, coffee and tea manufacturers and clothing retail manufacturers, that sort of thing, that people hear about sweatshops and human rights violations in fields and things like that. But lithium tends to be mined in places where there are human rights violations, or they're very high potential for human rights violations. And the recently enacted law in the US that went into effect over the summer imposes a rebuttable presumption that if any part of your supply chain involves any part that was mined in part or in whole in the Uyghur area of China, the presumption is that forced labor was used as part of that supply chain, and it's your duty to prove that it was not the case. And if you are not prepared to show that it was not the case, then your supplies could get stuck in customs. So just want to throw that out for people to be aware of. This is something that is going to become a big problem for a lot of our clients, I think.
Wow, that's incredible. I know coming years, I worked for 12 years for the tech industry back 2 years ago. And I just remember learning that, you know, some of the stories that in some other products, there were 12-year-olds working in the mines. And, you know, there was a woman I remember I worked with, and she was working on a technology to just track the metals from inside the mines, you know, and using technology to make sure that there wasn't forced labor, there wasn't youth labor. Really interesting that now it's come into the regulation there. So
Yeah.
thank you again. Another rich, fun fact that we can use and definitely be prepared for it. And I like when you talked about earlier too, it's like risk resiliency. You talk about this is a risk. Like we have to, as companies, as organizations, we have to, and even as consumers, start asking questions of the products we're buying. And especially in the medical industry, if you're a purchaser, you should be looking at these things and making sure that you're not doing harm within healthcare. Which brings me to my next question here. Can you speak to global ESG impact investing initiatives, including those led by Healthcare Without Harm, which focus on elevating the negative impacts of the healthcare industry on the environment? So I know you brought that up in our conversation previously. So you talk a little bit about the Healthcare Without Harm, because I don't know if our audience has heard about this organization.
Yes, it's a wonderful organization. If you go to noharm.org, you can find out a lot more than we will have time to talk about today. There are global initiatives, there are region-specific initiatives, country-specific initiatives, and just a couple that I want to point out for us today that Healthcare Without Harm is focused on. Now, the organization generally focuses on reducing the negative impact of the healthcare industry on the environment. So right in line with what we're talking about today. And then when we talk about the circular approaches specifically, some of the initiatives that they've promoted recently include initiatives to separate hazardous and non-hazardous materials so that everything doesn't just get thrown away, because there are hazardous materials as part of the overall waste. And if you can separate the non-hazardous waste, then you can figure out what part of that can be recycled. Phasing out of incineration, which causes all kinds of bad things. Reduction of harmful materials used in medical supplies in the first place so that they can be recyclable. Promotion of multi-use medical tools, which I think we're going to talk about later. And initiatives to promote sustainable food procurement and food waste strategies, which I thought was really interesting. I wouldn't necessarily think of that as a medical issue or medical industry issue, but hospitals are one of the biggest consumers of food because they have large staffs themselves and they have people coming in and out all the time that eat there. Like unlike a hotel, for example, where people come in all the time, but don't necessarily eat at the hotel. Your hospital patients are going to be eating there. So I've found it very fascinating, the different topics that fall within healthcare and environmental initiatives that I at least didn't, and it wasn't intuitive to me.
That is really interesting. I never thought of the food part either. Wow. Yeah, because you think about everybody there. You know, my mom was recently in the hospital, and you think she was all shocked what was the food.
Yes.
It was today for breakfast, and she said, "Oh, it's so nice. They give me a little menu. I can choose from a couple of things," and I just thought, wow.
It can be one of the most.
How do they know? Like trending and analysis, like this is a lot of food waste.
Yes.
Probably going on, and gosh, oh my goodness. But speaking of the equipment, you talked about, no incineration. I have seen pictures and witnessed videos of equipment that people thought was being shipped to a different place and they thought was being recycled, and it was being burned in an open pit next to a school, next to a community. They're all over the globe, and it's when you burn plastics and metals and the different things in the medical devices, it is toxic. It is very, very toxic, and then it stays for a long time in the soil. So in the pits where they've burned them, it just kind of, the mycelium and everything, the different microbiome kind of carries it pretty far into right next to where people are growing food for the communities and whatnot. So this is a big issue. And so Marissa, let's talk about how we can keep things out of the landfills and go on to you next. So what was the opportunity you saw when you were working local and emerging regions such as India, Costa Rica? Was it what was the impetus for this first to say, hey, maybe we could use some used equipment? And was it the medical equipment? Was it the higher rates of NCDs among women? Can you kindly elaborate on this, please?
Yeah, I mean, it was all of it, quite honestly. As an engineer, I mean, like, I'm just here to solve problems. And the fact that just previously I was I was working and developed a brand new technology. So the older versions were coming back and they were just sitting there and, going into the landfill. And I was like, this doesn't like it just, there's a disconnect. Like there's things that we can do. And so from my perspective, I was just like, let's figure this out. I mean, the fact that we were working in a country, but not participating in solving their healthcare problems seemed like a disconnect. And this is where a lot of like in-country companies or divisions of companies or small offices in multiple countries can actually participate and help with the communities that they're working in. Because why wouldn't you want to give back to where you are and where you're working? So this is not just, simply obviously a US focused, this is a rest of world focus. Because I mean, for example, Ernst & Young, I'm pretty sure they're in just about every country. And each country office often has projects that they work on or supports or, initiatives, and they vary upon, what's around, what's presented to them and things like that. So I think like as a company, you can participate and help. And so from what I was doing, I was working at a company that had excess equipment in a country in which we were working, like we were there and there was health issues and women are dying of breast cancer when we just created a brand new product. So it wasn't, like, I mean, it wasn't really rocket science. I mean, it was just literally putting two pieces together. Thank goodness. But I mean, it took an army to more or less make that happen. But, those are things that, and this is kind of the theme, the getting it done of Climate Week. Like, it was an easy get it done. It was again, easy. It took like a whole mountain of people to do it, but it wasn't a hard fit to figure out. And from there, I just kind of kept on thinking like, what else could and where else could this work?
That's incredible. Just to make that match though, but then you actually did action upon it. That's if somebody told me once, like there's a lot of people that have ideas, but it's the people that act on them and keep the perseverance to make them happen, that's when real impact happens. So.
No, thank you. And that's, right now we're also in the middle of UN General Assembly Week.
Mm-hmm.
And so again, there's lots of talk and I've been speaking to colleagues of mine and everyone says, well, you hear the worst and then maybe you see a few solutions and, so it's kind of par for the course. Like, you see, it's like you get inflated and then deflated and, what are the challenges? And, again, I think it was a really smart choice for Climate Week to choose getting it done, find solutions, do something. Everybody can, in a minimal way, do something.
Right, exactly. I love how you made that connection. Like this is in landfills and these people need it. And it's amazing what is thrown out. There's so much good stuff thrown out, and especially within the electronics industry, that can just, it just needs a tiny tweak or it needs a fixed screen or, and it's just amazing. And those are valuable. If there's a couple of studies out there that show what we're running out of, that we only have about 7 more years left of what's in, there's an element that's in our screens that we're looking at right now. We only have 7 more years left to mine that. So we're going to have to figure out a way to take the products that we have it already in, extend the life, which is one of the things of the circular economy, to extend the life of a product and to keep it in circulation. And it's exactly what you're doing is one of the major pillars of the circular economy. So kudos to you for doing that, Marissa. I have some more questions for you here. So how can the medtech community improve its practices using a circular approach? So you said, okay, we're making sure that we don't send it to landfills. How can organizations that maybe have some equipment reach out to you? How can they connect with you, partner with you and your organization? Because that's what I always hear all the time, Faith. I don't want to do the wrong thing, but I don't know what the right thing is. And I don't even know a phone number to call or a website to go to. Or it's amazing. Sometimes it's just knowledge sharing. I find that people just, I didn't even know that this organization did this and I can send my equipment there. The people who have if you go, I used to work in IT, and so I would go to the IT department. Every desk drawer was full of old equipment. In every healthcare IT department, every hospital, there are storage facilities with massive racks of just old equipment that's collecting dust. And I just think, wow, we could really put this to use with a little bit of repair, which is another theme of the circular economy, another pillar. So, what can we do? Show us the way.
Yeah, I mean, from our perspective, of course, HERhealthEQ.org, or, we've all our contact information on there. But it points to, there needs to, how can we upgrade instead of doing a full replacement? And we saw this in the pandemic. We became super resourceful of going into the closets, all these hospitals, and saying, oh my God, you know what? I actually do have 27 more ventilators sitting in the closet that we never needed. We do have all these defibrillators. You know what? They might not be the most pristine and the newest, but they still work. So, we all don't realize that medical equipment works for 20, 25 years. And I'm not necessarily talking about the disposable side, which is something we'll get to in a second, but, medical equipment lasts, like our computers, like any electronics, like medical equipment works and it's made to be durable, ironically. So the fact of the matter is, we can reuse it. And so all of these hospitals around the world started seeing like, oh my gosh, we have all this stuff. Obviously, now there's a lot more access in addition, but it's connecting with the right partners. None of us want to do this alone. Like, we are a solution for hospitals, for medical device communities and companies. We're their solution so that they don't actually have to do the work of like finding out how to repair it, finding out logistically who needs it, finding out, figuring out how to get it there, making sure it's actually being used, and, all of these things. That's what other organizations such as HERhealthEQ, we do. And we have the infrastructure to do that. And so these companies just in hospitals need to be able to partner with us. I was just reading this fact that ironically, and I think now we can see a little bit more as a result of the pandemic, but healthcare has more CO2 emissions than the airline industry. So we're all talking about, hey, do you want to click that button to reduce your carbon, your CO2 footprint, when you book your flight? You're not doing that when you have a hospital stay or you go into the doctor's office or things like that. So how can we reduce? And really, we need to reuse. So we need to reuse and repair and then repurpose. And there's been this massive trend towards, disposable, which is great, which is fabulous from, a healthcare perspective, especially for a lot of things that you and Danielle were also speaking about as far as, regulations around it, because it is very, very difficult to reuse certain things. And listen, like, it's really hard to reuse a dialysis, pump, like that is significant medical waste. But there's this disposable side has so much more waste. There's actually less recycling because everyone considers it medical waste, when oftentimes a small percentage of it is medical waste. The handheld that you've been using with your double gloved hand, you know what? You can just sterilize that and it's not medical waste any longer. It can be recycled or reused. There's also not very many monetary incentives for hospitals and companies to reuse and repurpose. And maybe, Danielle, I'm going to put that out to you, that maybe like these are incentives that need to be written into, into contracts, into legislation. And I have been seeing, and I've been hearing, not seeing necessarily, but contracts that where there are certain organizations that are saying like, hey, we want to work with you, but we need to make sure that, again, in the circular economy approach, like there needs to be a repurposing or a recycling, part of this. And it's only the most innovative companies that are doing that, but the bigger companies need to do it. And I was just reading something as a result of UN General Assembly and Climate Week last week, or yesterday, I was just reading to say like, if the big companies, such as, especially in healthcare, GE and Philips and Hologic and Medtronic, if they don't lead it, and this, we go to the bigger industries, we go to the Ciscos, we go to IBM, we go to all of these big industries. If they're not going to lead climate, nobody else is going to do it. And so there's this big call on them to do that. And that includes the medical industry and the healthcare industry. And so incentives to reuse, repurpose, and repair, like, less disposable waste. Another idea could be like, how do we upgrade without a full replacement? I mean, maybe it's just one or two probes that need to be upgraded and repurposed. Why does an entire ultrasound machine need to? And again, I'm not necessarily the scientist or technologist behind it, but there are ways to do that, and companies need to be incentivized to do it as well. So, I mean, those are just some ideas, but I could brainstorm all day long. So
this is good. This is why I'm sure our attendees came to this session, so they can get some ideas here.
Yeah, and we all need to be aligned. Like, investors need to be in line, partners, government entities, companies. Like, this is where everybody needs to work together to come up with better solutions, as opposed to, hey, we're HERhealthEQ doing it over here, but like this one over here, A hospital system, and B OEM, like, they're not on board. Well, we're going to be put out of business, because if nobody else is around the table, we can't do our work, nor do we want to. We don't want to do it alone. Like, that was never the intent.
Right.
Yeah, I was just gonna jump in real quick.
Really the only way. Oh, Danielle, go ahead.
I was just going to say, I think, especially in the US, the investors and the market always lead the legislation. And I just don't think, again, it goes back to people with blinders on. I don't think that everybody knows that there are tremendous climate-related opportunities within healthcare. You just need to get the word out. And when that happens, the market will follow. There will be investors that are interested in making these things happen. We just need to educate.
100%.
Profound. These are profound words being spoken here today. And speaking of the design and the reuse that you were talking about, Marissa, I'd like to now turn it over to Robert, because Robert is doing some really cool things. And Robert, I'd like to, are you able to share your screen, Robert? I know you have some fantastic visuals as well.
Yes, I will. And good day, everyone. It's fun to be speaking with all of you, and of course, a joy to be joined by these others on the panel. I will quickly tabulate on this and hope that everyone can see that. You can all see something that says pocket.
Yes, perfect.
All right, super. So I run a design company called Third Stone Design. We've been doing health-related design work for 18 years now. And really 25 years of my career have been focused on the issues we're talking about. Trying to bring medical technology to parts of the world that don't necessarily always get the latest stuff. And I've got a few examples of designs that are current to our firm, things we've worked on in the past few years that brought into the design process issues of sustainability, circularity, reuse, cleaning, and repair. So this first image is of a pocket colposcope. It's a portable imaging device for use in detection of cervical cancers and lesions. It is inserted vaginally, and you can take an image of the cervix. That image is then recorded on a digital device, usually a phone, which can then be looked at remotely by a clinician who may not be able to be in the field. So this could be administered by a nurse, and then a cervical cancer specialist could look at an image in a capital city or far away and make a determination as to whether or not that patient should receive biopsy or in turn be treated elsewhere. But the reason I bring it up is that a device like this typically would involve a consumable. There would be a sheath which would go over the front. And we've actually designed a lot of such things in our career. I've done a lot of consumable design and development. But in this case, we actually designed the product to be cleanable using what's called cold sterilization. So basically a wipe down, a soak, which means that now in its use, they're not dependent upon a supply chain. They don't need a box of consumables to be there. We're also eliminating the waste that comes with one consumable per patient. We have, in the process, also delivered a much more durable product, which can be used literally thousands of times for thousands of patients. This is something that's in the field now. It's being used on 3 continents by the HERhealth Foundation. See if I can get to the next one. Another example, a wearable infant monitor. So we do quite a bit of work with preterm babies in developing countries. And temperature and breath rate are vitals that you want to monitor on little babies. So these are babies that weigh about 1 kilo, 2.5 pounds, something like that. And their skin is super fragile. You might think of tissue paper is the best example I can use. Typically, we would put a sticker on that baby, like a thermal foil sticker, which can be somewhat damaging to the patient's body, but also it means every time you put a probe on a baby, you need a sticker. And those stickers are fairly expensive and hard to resupply. So we've developed a flexible strap, sort of a silicone strap, which wraps around the baby's body, positions the reusable probe against the abdomen, and allows us to determine core body temperature. The strap can be used hundreds of times safely. Again, it's cleanable, highly durable, and though more expensive as a one-off than that sticker, certainly much more economical when you amortize that usage over hundreds of uses. Another example was mentioned in the introduction is the Pumani Bubble CPAP. This again is a device for use in breathing support to preterm infants and small babies. There's something called respiratory distress syndrome. Essentially, in the pleural cavity, the lungs are one of the last areas of the body to develop in utero. So babies come out too early, their lungs are small and don't recruit oxygen the way they need to. This device, by circulating air inside the baby's chest cavity and keeping it inflated, encourage the growth and recruitment of that oxygen. So it's a relatively simple technology, but it can be hard to administer effectively and safely. So this is an outgrowth of an academic partnership with Rice University. It goes back many years now, but we developed this product you see in front of you, relatively simple medical device. And what's important to note here is that the product A is very durable. We have units that have been in the field and used thousands of times already. This is the one we mentioned. It's in 36 countries. It won an award for 1 million lives saved. It's been very effective. It's had a lot of impact. But also importantly is that we actually include inside the product itself the replaceable parts. So it's recruiting air, right? It's taking air in from the environment. It needs to go through filters. And when the filters get clogged or filled up or need to be replaced, we put spare filters inside the box. So the technician can open it up, swap out the filters, and they have everything they need. So it's just another way of making sure those supply chain issues don't affect the long-term usability of the product. Last example is something we're currently very engaged in. This is something called Stone Cold Systems. It's a actively cooled transportable refrigerator for vaccines. And I jokingly say, had I been able to predict the pandemic, I would not be talking to you all today. But we had been working on this for a number of years pre-pandemic. COVID-19 came along, vaccines came along. This allows for the safe transport of vaccines in the so-called last mile, or sort of the last 50 kilometers of delivery. Very important for outreach because keeping cold chain maintained all the way up to the patient's arm is a big contributor to the effectiveness of those vaccines. And we hear a lot about efficacy, which is how effective the vaccines are at the dock of the vaccine manufacturer. But whether or not they're still working when they get into your arm has a lot to do with cold chain and handling and other things. So this device addresses those issues. But something we've done here is incorporated active monitoring. So at any point in time, I can tell you where the vaccines are, whether or not they've been kept at the right temperature, whether or not the door's even been left open. And that's another theme that we're seeing now in product. is the incorporation of monitoring and active determination of utility. So if you think about sort of Internet of Things, it's being applied into medical devices much more routinely. Our firm's doing that across a variety of different products. And what that will allow down the road, we think, is potentially a service model where you're paying for the service as opposed to paying for the product. That then puts the incentive back on the manufacturer to make sure that the product continues to be used. And it also allows us to keep track of things that aren't working. So in the case of this device on the screen, we know, frankly, before the user does, if there's an issue. And we can reach out through a text message, through an email, through an alert on an app, on a smart device, to say, hey, your product isn't working as it should, address this so there's no long-term issues. So there's just some examples of the type of design work we do. And it was interesting to hear Healthcare Without Harm mentioned this morning. They're an organization I've been aware of for a long time. It is just true that there are definitely sometimes at odds issues between disposability of sterile items and the intention to maintain an infection-free zone compared to creating mountains of waste. And those challenges, I think, are thought about more and more in design. The good news is that designers want to address them. And there is then a host of issues which make that sort of a difficult gauntlet. So I think that it's great these conversations are happening. And I hope that these examples sort of give a couple nods to ways that it can be addressed.
Thanks, Robert. That was amazing. I love those visuals, very inspiring. Just all the things that, just thinking about things from a different design perspective and designing, for the long term and trying to design for less waste and designing for the people. Design for people and planet is really what you're doing there. It's very, very impressive. Thank you so much for sharing that with us. And now I'd like to take just a few minutes to allow all of our panelists to ask each other a question, something I always do is unique when we do these sessions. So Marissa or Danielle or Robert, please feel free to ask a question to one of the other panelists that maybe you've been, here's your opportunity. And also we want to showcase how, collaboration in action here.
Yeah, I mean, one of the things that I was thinking about, and Robert, I've been obviously following your company for a while, is this points to health equity, which is obviously what we're talking about. All of this, as the title of the discussion. But this becomes a health equity, and not just a women's health equity. This is a general health equity to make sure. I mean, we again, I keep bringing up the pandemic, and probably will for the rest of our lives. But we saw the inequities. We saw that there's regulations and rules why around the certain items, which unfortunately is disproportionate. Why African American and people of color were disproportionately affected by COVID-19 because they weren't able to sense. So like pulse oximeters can't sense through multiple colors of skin, because they weren't designed that way, which is ridiculous. And a lot of the work that you're doing, Robert, is speaking to this health equity side. So making sure that vaccines can get to the last mile. That's proving and showing equity. Is this a theme that you've been seeing, that people are trying to, like on a global scale, kind of distribute and get product and create solutions that are a little bit more equitable for everybody, as opposed to just just the developed world, the US, Europe, Australia, Japan?
Mm-hmm. Yes, it is a theme. Faith said something interesting, design for the people. And I think that as a product designer and sort of our little niche in the world, if we've been doing it right, we've always thought about all the users and all the potential people who might pick up the product, right? So equity to us was always just the broadest swath of potential users seeing benefit from our designs. What I do see now is more openness to discussion of these issues at the board level, at the regulatory level, at the investor level. So there is a heightened sense of awareness, which is coming through to say it's worth spending time thinking about those issues, which may be somewhat cynical, but the example you brought up, which is a great one, pulse ox being able to detect oxygen saturation through different skins and different amounts of melanin in the skin. Someone knew that early, and whether or not they chose to address it, unfortunately, was a corporate priority issue. That will be different today. Devices developed like that will be thought of differently today. But I'm just I want to give the designers out there and the engineers a little bit of credit. I'm sure they flagged it pretty early. Said, hey, doesn't work on Fred. And someone was like, well, Fred's not our market. And that's what I think is different now is everyone recognizes that these need to be working in a variety of different environments. So far as emerging markets and low and middle income country application, that's still coming, is what I would say. It's a huge potential markets. All of the growth, all of the youthful populations of the world are in places with, that fall into that L and M of the LMIC. And so the mass of humanity that will benefit from health technologies are in those places. That's sort of at the core of our thesis. Getting the big corporate players in med tech to pay attention to that is still an ongoing process. So
For sure. Danielle, is this something that, almost building on the same question, like this is the S in ESG, like,
Right.
Is this something that we could, and not we, not Robert and I, is this the core, the general we, is this something like that can be pushed on a little more and not regulated, but, focused on and regulations and corporate responsibilities be put in place to focus a lot more on this S? I mean, diversity in clinical trials. Like I can talk all day about that because clinical trials is not just drug clinical trials. People forget, like it was, hey, this pulse oximeter, yeah, Fred didn't matter. So it's like, how can we ensure, that the proverbial Fred matters and that, and proverbial Jane matters as well as, as far as women as well.
Mm-hmm. So I think one of the types of thing that pushes things to the forefront of people's minds is a crisis. And I think because of the pandemic and the fact that there were separate, totally unrelated racial justice issues that were top of mind for people at the same time, they were able to connect the two, right? So I think in terms of healthcare and something else, I think within the S, it's going to be easier to connect healthcare with other S issues, with women's health issues and socioeconomic class issues, etc. And I would love to see that branch out into the E. And I've said it probably 3 or 4 times now today, but I just don't think people are thinking about it that way. And once they do, all of the investors, for example, who are looking around for some sort of environmental issue to focus on will grab it because it's, killing 2 to 5 birds with 1 stone, in the sense that you're checking off a lot of ESG issues by focusing on, environmental issues within healthcare or racial issues within healthcare, women's issues within healthcare. It's a great way, it's a very efficient way to make an impact. Hopefully we won't need a crisis, a separate new crisis to make that happen, but we might. And if we're running out of things in 7 years, and all of a sudden, like, sorry, we're out of stuff, you cannot get any healthcare anymore, then people will suddenly wake up.
This is true. I encourage people to look at that chart. There's a great chart out there that talks about that. Different things we're running out of. We're running out of arable soil to grow food in. We only have about 55 more years of that. So if we don't have food, well, that's a problem. Yeah. So these are things we need to focus in on and think about for, again, like you talked about, Danielle, that risk resiliency. Like, let's not think about it right when it's happening, like we did during COVID. Oh no, we're running out of this stuff. And no, we didn't plan for this stuff. Or we don't have any reusability, repair. We don't have any repair. We don't know how to repair these machines. We don't have anybody to repair. We don't have people to repair these machines. It's that total intersectionality between that people and planet and profits for all that will get us to healthy and happy and successful communities. So now I'd like to turn it over to our esteemed attendees that are here. Esteemed because they chose this session and they're thinking about these topics and doing good as well, or wanting to do good in the world as well. So attendees, please feel free to, you can raise your hand and I can unmute you, or feel free if you're able to type in the chat, if you type your question there. What questions do you have for anyone on the panel here today? Give everyone a moment to think, type out their question or raise their hand. Don't be shy. This is your opportunity. This is how we create change. Collaboration.
If I had a direct question come in to me,
Oh,
so
I
I'm
didn't see
responding
much
to it.
effect. Yeah.
But it's what are our potential customers and any targeting audience? So I'm assuming that's for HERhealthEQ. Happy to respond. We're targeting medical device, hospitals, and clinics in the what's considered the developed world that are oftentimes repurposing equipment, just figuring out where we can get them in the developing world. So we partner again with clinics and hospitals in lower middle income and markets and emerging markets, and really interesting doctors who actually care about women's health or want to further women's health in their communities. And so those are the people that we target and partner with. Oh, bunch of questions coming in now.
This is so energizing, Hillary says, to think about problems in new ways. Marissa, where can I find more information about the CO2 emissions in healthcare greater than airlines? I'd love to read more about this study.
I will try to pull it up in the next few minutes, but if I'm not, Hillary, I will reach out to you and definitely get it to you. It was an interesting fact, actually, that recently came out. It was in one of our Climate Week briefings, so I'll make sure that that comes out to you. But I think on climateweek.org, there's a bunch of these studies that have been published as well. But I will make sure I get that one out to you.
And our next question, what healthcare companies do you think are addressing climate change and health equity well, and how and why does this stand out? Anybody know of, well, I would think that's some of the ones you're working with. It seems like who put those projects together, because it seems like they're thinking about people and planet.
Well, I was going to maybe answer the question a bit more broadly, which is there's a significant movement afoot, and most of you, I'll touch on it in some way or another, to bring healthcare to the home, to democratize it, so to say, whether that's with wearables or portable devices, which I was demonstrating, which can be brought to the field, brought closer to the user. And the environmental benefit of that, in fact, is that now we're not requiring people to travel great distances to the hospital facility. In many cases, we're keeping them out of the hospital through outpatient care. And Danielle actually mentioned some of that, all the food you need to feed them and all of the various climate and carbon impacts associated with hospital stays, not to mention the facility itself and how big it needs to be and how much energy it consumes. So I'm not going to name a specific company or product, except to say that I think there are a number of organizations working on distributed technology solutions, which can be used in the home as sort of a broad category, but in the home or in a outpatient clinic setting, that are in fact addressing environmental and climate issues, even if that may not be their express intent. They're trying to address healthcare user patient convenience and compliance. Much more likely that you're going to do whatever your therapy or routine is if it can be brought to your home, or you can do it down the street as opposed to having to drive into the Capitol. So that's where my focus is, and I think it's an interesting area because it combines sort of personal incentives with broader climate incentives.
I would have never
I
thought
also-
of that. Yeah. Oh, go ahead, Marissa.
No, I was going to say it's an interesting question, and I agree wholeheartedly with Robert. I think ironically, it's newer companies that are far more innovative than, and I don't want to throw anybody under the bus, than some of the older legacy companies. There are older legacy companies that cannot figure out their sustainability practice, and some of them are the largest ones in the world because it's so all-encompassing that they're almost afraid to put something out because something's going to get missed. And so by waiting and not putting something out there and not making the changes, they're just perpetuating the problem. And so some of these newer companies that are a little bit more niche are able to very quickly address it. They have young design teams, they have innovative thoughts and leadership. They're going after lower middle income countries. They're going after, some of these newer problems where in a large company, it's been very hard to innovate and create these broad sweeping programs and policies. We have direct feedback that there's some of them that are the largest in the world that can't figure it out because they're so afraid to not get it right that they're just not acting. And so that's where, I feel like partnership, can be a great ally for them. So yeah, and I know we're close on time. There was one last question I saw that came in from Robin McKenna. Current focus appears to be on NCDs such as diabetes, cancers, and what do we see as the NCDs of the future? And do we see this issue of health equity growing in developed countries? Health inequity is a massive problem in every country. Let's be honest, including our own. As far as NCDs go, it's the developed countries that are leading the way. So again, it is diabetes, heart disease, cancers. It's what are considered health conditions, quote unquote, of the affluent, and people sitting at desks and not being as active. And so these are the trends going forward. Communicable diseases are always going to be around and prevalent, but these NCDs are often ones that could be prevented in many respects. So just wanted to get that direct question in.
Oh, perfect. Yeah, I didn't see that one because it was sent to you. Thank you so much, Marissa. Well, I think we're at our time here. So thank you so much, Danielle and Marissa and Robert. I'm going to go back and listen to this recording probably 3 times and take notes and follow up items because this was some real action in here. And I really appreciate you all sharing your stories and visuals and everything around the finances, the product development, and the nonprofits that are willing to partner. So thank you so much to our STEAM panels. Thank you so much to all of you as attendees out there. That you had a lot of choices. So thank you so much for choosing us. And any last word from our host here, Marissa?
No, thank you, Faith, so much for being an incredible moderator.
Take care, everyone. Be well.
Bye.